I think that for high-risk patients, the correct approach is to see the entire picture. It is a bad idea to focus only in if the patient has or not a CTO. It is a bad idea to focus only in one issue, no matter which one. I think that regarding the high-risk patient applies the very same idea that you should use for approaching a CTO, which is you should keep your eyes in the big picture. You should consider the risk of the patient, the benefit expected for your intervention, the chance of having success of the intervention itself, and the chance of having success in your center with your resources and skills. And after that, you should take the decision. No, by looking only the risk, only the CTO, or only one thing. You can leave a CTO untreated when the risk of the intervention is bigger than your expected benefit. About that, let me share with you some talk from the Tao Te Ching, the classical book. Act without action. Sometimes the best to do is to do nothing, which means medical treatment. If the patient is a low-risk patient with no angina, with no problem in his everyday life, because it's already good, and if the patient is a high-risk patient, but your intervention will not add benefit on survival, I think that the best idea is do nothing, as Lao Tse said a long time ago. I think it's a good tool. Unfortunately, in my country, with low resources, we don't have the resources of the developed world. We don't use it, but I think that I can't deny that it's a good tool. I'm not sure about the situation in high-risk patients because the procedure itself is time-consuming, is contrast-consuming, and the risk is higher than the risk if you perform a classical CTO recanalization in anterograde or retrograde way. So I will say that it's a good tool. You should keep this tool in mind when you can, but I'm not a fan of this procedure. I think that the main focus is to analyze which is the best patient for being treated, and considering that, you should keep in mind that CHIP is not only about the cath lab. CHIP is about the preparation of the patient, it's about the procedure itself, of course, but it is really important in this group of patients, the post-operative take care of the patient. I mean, if you are the best interventional cardiologist in the world and you do magic in the cath lab, but after the procedure, you don't have a good care of the patient, in the cases of cheap patient, the patient will pay a high price for this mistake.